All right, good morning, Dr. Snyder.
Good morning. Thanks for having me.
Thank you. So I just wanted to ask you some questions about bariatric
Sure.
surgery. So can you just start by telling us a little bit about yourself and what interested you in bariatric surgery?
Well, it's somewhat of a circuitous story. I grew up in Miami, went to Harvard where I was going to be an archaeologist, realized I kind of wanted to deal with people, not just fossils. And what I did is then I went on to medical school. I don't really know how I got in, but ultimately getting into med school, wanted to be a family practice doctor, was not good at that. Trauma and surgery was kind of my jam, but the problem with that was that I didn't really like the surgeons that much. So eventually I cascaded into general surgery with trauma and cancer surgery. And then what happened was kind of amazing. I found this thing called bariatric surgery. And it was kind of the closest I could be as a family practice surgeon, where I get to do surgery, which I like, highly technical stuff. But I also like the fact that I get to follow people through the whole trajectory of their world. And the thing I found the most amazing was that I got to deal in hope. You know, in a world that's kind of hopeless sometimes, like everyone who comes into me, if they leave with a spark of hope, I just love that. I feel like it's a total blessing to be part of that process. So bariatric surgery, I joke with my kids, if you don't love Monday, you need to change your jobs. And I love Monday. I get to go to work, I get to help my patients, I get to be part of their life. I get a very small assist, but it really feels monumental to me. And I just love it, and I love the patients, and I love the fact that I don't just deal with symptoms, I deal with the actual problem.
Interesting. So what is the most common question you get from a patient considering bariatric surgery?
Well, it's actually interesting because this is the question people deal with. They kind of put in the back of their mind when they're going to come into my office. But what happens is that this is really what's percolating, and they're almost embarrassed to ask me this. They say, why don't I just diet and exercise again? And that's a great question. It's like, you know, should I get married? Should I date a little more? You know, it's kind of that question. And I guess the thing is, it really reduces it to the real reason of what I do. We do have a diet and exercise program, but someone that's going to have surgery has, as you know, a BMI of 35 to 40, 80 to 100 pounds overweight, and usually associated problems aggravated or caused by their weight. Diabetes, hypertension, sleep apnea, joint pain, sexual things, whatever they got going on is aggravated by their weight. And the reality is this, and this is just if no one knows anything else whether or not you're going to have surgery. If you have a BMI of 35 to 40 plus, your chances of losing weight and keeping it off for 5 years is about 1%. The best studies is 3%, and that's never been repeated. So you almost have no chance of losing weight and keeping it off. That's why you come to me. So if someone comes to me with a BMI in the 40s, I say, look, you need to be here if you want to lose weight, because it's the only chance you really have of losing weight and keeping it off. And the weight and its problems is what's going to ruin your life and kill you. It's that simple. It's a genetically related, fatal, and costly problem. So if you come to me, that's what you need to know. And that sort of debunks the whole diet and exercise thing.
So there are a couple different types of bariatric surgery, correct?
Yes.
So how do you decide which type of surgery to do for each patient?
So we offer everything here. I do sleeves, I do bypasses, I do mini gastric bypass or OAGB, which is not part of our ASMBS regimen traditionally. In my program, we do duodenal switches. I don't particularly do them, but I think it's a great revisional procedure. And so for me, I do as much or more of this than just about anyone in America. And I don't think, well, you're getting an A procedure, a B procedure, or a C procedure. Every procedure has its special place in your life if you're considering this based 100% on your knowledge that you're an educated consumer, and also the fact that they all have different results, kind of, and they require different things of you. So you have to understand what your life is going to be like and what you want from the procedure. They're all reasonable in the right situation. In 3 to 5 years, they're all pretty much the same.
Okay, so there isn't one that is considered more effective than any other.
There is not one that's considered more effective. Now, I have to know about you. That's why I always start with interviewing you. What's going on? What do you bring into the table? Because I can say, hey, this one may be better for certain issues you have going on. And that's the purpose of a good program. Come in with your education. The internet's a great place to frame questions and have a familiarity. Coming to see me is how you get the answers to those questions.
Okay. So what is the most common question you receive from a patient considering weight loss surgery?
It all has to do with the rationality of being here, but people really want to know 3 things. Number 1, is it safe? Okay, in our hands, in a center of excellence, having bariatric surgery is as safe as having your appendix out. No one gets stressed out about having their appendix out, right? It's extremely safe. From mortality to infection to potential problems, we go through our data. We're a center of excellence, so we have to be transparent on what we do and how we do it, that it's safe. Is it effective? Everyone wants to know what's going to happen to me, and I can give you the idea of how it's effective. And the third most important thing is people think, what do I have to bring? And this is critically important. Bariatric surgery is for people that have morbid obesity or severe obesity with associated problems. And it's genetically related, so it's epigenetic. And I don't know if you know the term, but epi means how you trigger your genes. Genetics, how you're wired. Epi is how you trigger them with diet and behaviors. So the surgery levels the playing field. Okay, and that's critically important because once I level the playing field, you have the potential to succeed at things you always failed at before. Okay, and so you still have to do what I do. You still have to be mindful. You still have to have a reasonable dietary regimen, and we'll teach you what that is. Don't diet anymore. That's just dumb. And you actually have to bring activity into your life. I don't want you sweating to the oldies necessarily, but you have to have activity. We'll teach you those things. Everyone who gains weight after bariatric surgery, which is the next big question, what about people who fail? 100% of the people, except for the rare technical problems, is they aren't compliant with our reasonable expectations of a life that leads to durable success. Okay, everyone will lose weight with bariatric surgery. Whether you keep it off is what you do with it. And the joke I always say, having bariatric surgery is like getting married. Getting married is very easy. Being successfully, happily married forever is a lot of work. Bariatric surgery, easy. Being successful a long time, that's a lot of work. We'll teach you the tricks.
Okay. Have you seen bariatric surgery change much over your career?
You know, it's less invasive, it's less impactful. The way we treat pain, for example, people have a lot less discomfort afterwards. People are walking around the hall 2 hours after surgery. The complication rate has plummeted. You know, my favorite thing is if I go by the ICU, if they don't know who I am, that's amazing. It means I don't have patients routinely in the ICU. It used to be part of the deal of what we did in bariatric surgery. Now with minimally invasive surgery, everyone is home in 1 to 2 days pretty much. That's incredible. If you want to go back to work in a week, I'm like, go back to work in a week.
Wow.
Yeah.
Can you tell us about a patient success story?
Well, I mean, it's funny. I just got a text as we were walking in. I give all my patients my phone number, which may be stupid. I don't know yet. Because I like my patients. I love hearing it. And a patient texted me 9 months post-op, down 135 pounds. She just got her PADI open water diver certification, and she's going to dive in a very tropical location, and she has 30 pounds more to go.
Wow.
And she's just, her whole reason to do this was to become a diver, and I just love that. I have another patient who drives dragsters. Like she fits in a cool, a fire suit. I don't know what that is. I have patients. I got another text from a patient who was showing me standing in her pants. You know, that classic weight loss photo. She said, "I've lost half of me." I mean, I get these texts all the time.
Wow.
I love the texts.
That's amazing. So are there any last bits of wisdom you would give to a patient who's considering weight loss surgery?
So first of all, go to a center of excellence. We're a center of excellence. Next is I really, really advocate going to a high volume center. And that's because they have enough support to do a high volume. I mean, in our program, the things we bring to the table is better than everyone in the region by far. And the reason is because we have the best, most trained surgeons with the most experience. The hospital and the program provide us with an incredible amount of support. And it's not about doing surgery. The surgery is pretty easy. I mean, a sleeve takes 35, 45 minutes, a bypass, hour and a half max. And we do 20% of my practice is revisions, and that adds 10, 15 minutes to the case. But it's not about surgery. It's about if we can give you the tools for success and the education. This should not be a surgery, a slap on the back, or a handshake, get on with your life. This should be, we're with you all the way.
Wow, that's great.
And I'd be honored, anyone who wants to talk to me about it, you do not come in to have surgery. You come in to see if this is safe and reasonable for you. That's what I love. I will never sell you because I don't know what's right in your life, but I need to educate you.
Wonderful. And your practice is taking new patients currently?
We do. We have taking new patients. And we have 4 surgeons now. I expanded, so it's pretty incredible.
Great. Wonderful.
Thanks for having me.
Thank you so much.
Thank you.